Chinese medicine, like Indian medicine, is ancient, dating back over 3,000 years. And another similarity with Indian medicine is its emphasis on the natural world, holistic approaches to medicine. The earliest views of disease in China viewed disease as being something distinct from or outside of the body. Well-being or health depended on war, harvests, relationships with ancestors. And transgressions against social norms would anger the dead and require sacrifices. Communication with the dead was necessary to determine the causes of disease and their remedies. Later, political changes led to a change in belief. Then, during that period of time, disease was seen as the result of unseen demons who were not deterred by moral behavior nor related to ancestors. And in those eras, prevention of disease depended upon alliance with superior metaphysical powers, and removal of disease or curing disease required spells or noxious substances that would kill or chase away the demons. These ancestral and demonological views of health and illness still have some influence on modern Chinese and East Asian medicine even today. For example, the emphasis on cause and effect in these earlier perspectives persists. Chinese medicine changed again right around the time of the first unification of the country, around 200 BCE. The earliest written Chinese medical manuscripts date back to 167 BCE. And by the 1st century AD, medical thought had been compiled under the name of the mythical Yellow Emperor in the classic manuscript, the Inner Canon of the Yellow Emperor. This work was later refined in a second major work, the Nanqing. Other manuscripts dating to around that time recorded Chinese pharmacologic knowledge, which was significant and persists to this day. These and other manuscripts reveal a close connection between Chinese medical thinking and the structure of Chinese society at the time. For example, humans are described as a set of systems that store, distribute, and process resources, just as you might describe a society or a city. There was no conception that the mind and the body were separate in Chinese medicine. The systems that were attributed to the body were linked by channels that transported resources between the systems and to the outside world or from the outside world. Language used to describe these views were based upon metaphors that reference the social, economic, and geographic structures of Chinese society at that time. For example, the Inner Canon states, a human body is the counterpart of the state. The spirit, that is the body's governing qualities or shen, is like the monarch. The blood, the shu, is like the ministers. The qi, energy, is like the people. Thus, we know that one who keeps his own body in order can keep a state in order. Loving care for one's people is what makes it possible for a state to be secure. Nurturing one's qi is what makes it possible to keep the body intact. In the Chinese conception of medicine, health depended upon maintaining harmony within the body and between the body and the environment. Healing was a matter of restoring harmony. Resources were described as essential vapors, which is very similar to European concepts of pneuma or spiritus. And these essential vapors circulated through the organism and were distinct from the blood. Illness occurred when one or more systems failed to perform or the essential vapors were depleted or blocked from circulating. Conditions leading to illness could be caused by an unhealthy lifestyle or failure to adapt to new environmental conditions. In contrast to Western medicine, the Chinese did not conceive of the body as a machine and did not develop what we would call a biomedical conception of disease or therapy. They didn't focus on anatomy or matter, but rather on processes and balance or the lack thereof. The ideology of systematic correspondence was based on the view that harmony was normal and loss of harmony, that is an imbalance, was an abnormal state of existence. It held that regular behavior and environment promoted health, and irregular behavior or an irregular environment promoted illnesses. And again, note the correspondence with the thinking about human health and the health of a society. This ideology assumes a relationship between tangible and abstract phenomena and led to the idea of two, yin and yang, or five, the five phases, category of all phenomena. Yin and yang were based upon the perception of two antagonistic categories of all existence. For example, day, night, male, female, heaven and earth, dominating, submitting, summer, winter, and so on. The five phases school equated health with five environmental elements: metal, wood, fire, water, and soil. For example, the liver was associated with wood, the spleen with soil. Wood could move soil, hence relationship between the liver and spleen could be explained as the ability of the liver to dominate the spleen. These ideas were linked with physiology, disease etiologies, and therapies. Pharmacology seems to have developed independently of these ideas of systematic correspondence. And involved an extensive collection of herbal or natural medicines. Buddhist and Taoist conceptions of disease suggest that good actions are rewarded with health and wrongdoings could lead to disease. These conceptions often overlapped again with the views of the state. Divinities often resembled governmental officials who did the moral accounting that determined the health costs of immoral behavior. Prevention and treatment of illness in Chinese society proceeded through two approaches. One view was that disease resulted from invasion of the body by abstract or tangible entities that perturbed or destroyed functional units within the body. And this viewpoint led to easy acceptance of Western ideas of microbiology and pathology in the 19th and 20th centuries. That is, they were easily adapted to the idea that pathogens or microorganisms could infect you and cause disease. This viewpoint also suggested that essential components of nature, heat and cold, dry, moist, wind, etc., may lead to harm if they enter the body at high levels or the wrong time. And this concept of the wind as being an effector of disease connects back to earlier and more ancient concepts of spirit-caused disease within Chinese societies. A second, more modern view of health focused on disturbances on the functions of and relationships between the functional units of the body. Diagnosis in Chinese medicine depended heavily on monitoring the pulse as well as simple observation and palpitation of the abdomen, limbs, etc. The pulse could provide information about the circulation of the qi and thus of imbalances. What were the treatments that were used in Chinese medicine? Again, let's go back to our three categories of therapy: psychological, physical, and chemical. Chinese medicine certainly had psychological treatments. The relationship of the provider with the patient, for example, would have psychological components to it. But they had few, if any, really significant physical therapies. That is, surgery did not play a large role in Chinese medicine at the time, although we can easily speculate that they must have had the ability to treat minor trauma, minor broken bones, and so on. However, there was a sophisticated set of chemical therapies that were available in Chinese medicine. I mentioned that one of the ancient texts of Chinese medicine was their Materia Medica. They're describing the pharmacology of the time, and that these medications primarily consisted of herbal medications, many of which are still used today in Chinese medicine. Again, the goal of therapy in Chinese medicine was to restore balance by restoring positive qi and removing pathogenic qi. Therapy could also be aimed at removing blockages to the appropriate flow of qi or zhu, the blood. Therapies were usually a combination of treatments. So dangerous symptoms, for example, a coma, had to be treated first before underlying imbalances could be addressed. And we see that same concept in Western medicine today. If a paramedic arrives on the scene of an accident, the first thing they're going to do is treat immediate life threats before addressing other issues. In Chinese medicine, drugs were generally used to restore the qi to balance again. So this sense of balance being the key to health comes up again and again in Chinese medicine. Another important tool of Chinese medicine was acupuncture. The goal of acupuncture, of course, is to restore the appropriate flow of qi through energy channels within the body. So the precise origin of acupuncture can't be determined, but it's already described by the time that the Inner Canon of the Yellow Emperor that was published. And the goal of acupuncture was to restore energy flow through the body. Needles and acupuncture needles are inserted along 14 invisible lines or meridians that run along the length of the body and are thought to be the normal pathway or tracks upon which qi can flow. Moxibustion, which is the burning of small pellets or dried wormwood on the skin, similar to cupping, was meant to stimulate key points of tracks along the tracks of qi circulation as well. And of course, there were religious practices as well in ancient China, and some of these must have had psychological benefits as well. Another important piece of health practices in Chinese society at the time were meditation in the Zen, Tai Chi, and Buddhist traditions. In contrast to the West, medicine in China did not develop into a true profession. There were state medical doctors, primarily male, who served members of the government and the wealthy, but otherwise physicians learned medicine by studying texts or through apprenticeships. There were also midwives and wet nurses who were lower status than physicians but were tolerated. And of course, as in most other societies, there were large numbers of quacks, priests, shaman, masseuses, and other low-status practitioners of medicine as well. Finally, as in the West, the first hospitals in China were religious institutions providing supportive rather than therapeutic care. In this case, in China, these were primarily Buddhist and Confucian religious institutions.